It's time for Woo's Wisdom. Dr. Barry Eiden presented on the management of preclinical and early phases of age-related macular degeneration. Let's review some of the key takeaway points from his presentation. So risk factors for AMD can be thought of as either modifiable or non-modifiable. Modifiable risk include UV exposure, smoking, obesity, and levels of protective photopigments in the macula. Non-modifiable risk factors include things like age, family history, genetic risk, race, and eye color. There are some really great pre- and subclinical and early-stage diagnostics that can be used by eye care practitioners for early detection of AMD, which could provide the best chance of helping patients maintain good vision and independence later in life. Some of the things that he included were genetic testing. So genetics can contribute to 71% of AMD cases, and it's the most important non-modifiable risk factor. Genetic testing can provide patients with a genetic risk profile to customize care and monitor how frequently you'll be seeing these patients. He discussed contrast sensitivity testing, dark adaptometry. So dark adaptometry, research indicates that dark adaptation may aid in detection of AMD up to 3 years before you see any sort of physical signs in the macula. Indications for early stage diagnostics could include testing patients that have issues seeing or driving at night, patients that are at risk for AMD, and patients with AMD to just monitor their disease progression more closely. Other diagnostics that were discussed were different types of retinal imaging, an innovative instrument design that allows for home-based monitoring, and then on the horizon, at-home OCT devices. Lastly, Dr. Eiden reviewed ways to bill and code for dark adaptation and some other monitoring procedures that you may adopt in practice. So be sure to check out his complete presentation for all of the necessary details on taking care of patients before vision loss and structural changes secondary to AMD. You can find Dr. Eiden's handouts and presentation at woou.org under past events.